Morning everybody. Look, we wanted to let everyone know that in this part of the state we're participating as part of a state research program with local councils to look at sewage sampling to test for the presence of COVID virus. We've had some sampling done recently in Albury and we've had some done in the southeastern part of the area over in the Perisher ski fields area. The Perisher ski fields did provide some fragments of the virus, and that's what the labs are able to find. They don't find necessarily active virus, but they find fragments of the virus in the sewage that's sampled. And we're continuing to work with councils in this part of the Murrumbidgee to roll some of the sampling out in this area.
Why was Albury and Wagga chosen for this?
Look, I think Albury was probably initially chosen because of the issues around all the border crossings, the number of people that were coming across through the Albury area. It gives us an early warning, I suppose, of some potential virus in an area. It doesn't necessarily mean that we have cases in an area, so that's very clear. We will be letting the public know if we do have positive results that we need then to do further testing or further case testing in the area.
How specific can you get with figuring out which areas the COVID could be in with the sewage testing?
Look, we need to work with the local council to work that out. But in Wagga, council has 3 main treatment plants, and look, they pump sewage into those plants. I'm sure if we did additional testing around some of the around some of the pumping stations, they could then be a bit more definitive. But we need to work that out with the local council.
So has testing started locally within Wagga?
No, it hasn't. We are liaising with Wagga City Council to bring it on board, and we're very confident it'll start any day.
What about in Albury? Has that started?
Has started in Albury and started a couple of weeks ago, and they're doing weekly sampling from the treatment plants in Albury.
I'm not sure no results.
No, nothing at this stage.
What about the Perisher example? We understand that there was that positive result from the sewage,
yes.
And then they went and did a testing blitz.
Yeah, and there was no correlation. And look, it can be the fact that someone's travelled through the area. Doesn't necessarily mean we've got an active case or anything like that. It can be, again, something associated with people being asymptomatic. But we will be upfront if we do get any positive results.
If you do get positive results, what can you do with that information?
Look, as I said early on, it's a research program. It's really to hopefully give us better guidance in case detection and further follow-up as part of any outbreak if we do have it. It's not necessarily linked to, as I said, a specific case or a problem in an area at that time.
And that stuff that's detected in sewage, is that active virus? Can people...
Look, it's a fragment. We actually don't pick up the virus. The way the process with sewage works, we pick up the fragments of the virus. They're not tested locally. It goes off to a Sydney lab as part of the research program.
Is Wagga Wagga the only local government area within the Murrumbidgee Local Health District that you'd be looking at starting the sewage testing, or could we see this in other communities as well?
Look, it's really going to be based around advice from the Chief Health Officer and the research panel that are working on this program. We're looking at a number of the major regional centres, the department is looking at a number of the major regional centres across New South Wales, but Wagga and Albury are the 2 in the Murrumbidgee district at this stage.
Is this something that we could see continue going forward for years to come as we come to grips, I guess, as an entire globe of this outbreak?
Look, it's hard to say, and I suppose it really depends on what the results of the research program shows. It's weekly sampling in the foreseeable future, and we've just got to see what the results bring forward.
How quickly do you get the results from the sewage sampling?
Look, I think they come through pretty quickly because it's a microbial sample. The treatment plant operators for all councils do regular sampling as part of their licensing requirements. So it's got to be indicative of what's happening at the time. I'm pretty sure we get it back within a week. But we've got to allow for here sampling, sending it to Sydney, the lab doing the analysis, and then feeding the results in from there. All good. Thank you.